All right, so swallowing, or also known as deglutition, is a coordinated process that moves food or liquid from the mouth to the stomach, while also protecting the airway. So swallowing begins before even food enters the mouth. So visual, smell, and touch cues do help prepare the swallowing system for eating. So there are sensory inputs from the cranial nerves 5, 7, 9, and 10 that do play an important role in the bolus control and the timing and triggering the swallowing. So the oral preparatory phase, it is voluntary and occurs in the mouth. So during this phase, that's when the lips close to keep the food in the mouth, the jaw and the teeth, they chew the food, and then the saliva also mixes in to form the cohesive bolus. So the tongue shapes and holds the bolus, while the cheeks will help prevent the food from collecting along the sides of the mouth. And so during the oral transit phase, the tongue moves the bolus towards the back of the mouth using anterior to posterior pressure. And then the soft palate elevates to prevent food or liquid from entering the nasal cavity. And the pharyngeal phase is involuntary and is controlled by the brainstem. So once the swallow is triggered, then several events do occur rapidly to protect the airway, including vocal fold closure and elevation of the larynx. So breathing will briefly pause during this phase, and the upper esophageal sphincter opens up to allow the bolus to pass into the esophagus. And then during the esophageal phase, the bolus is transported to the stomach through the peristaltic muscle contractions. And then the lower esophageal sphincter relaxes to allow the bolus to enter the stomach, and then it contracts to prevent reflux. So all of these phases, they work together to ensure safe and efficient swallowing, while also protecting the airway during a typical adult swallow. Thank you.